At NewsNation, we're working to bring you just the facts surrounding the coronavirus vaccine. Joining us now is Dr. Amesh Adalja, senior scholar at the Johns Hopkins University Center for Health Security. Welcome. Nice to have you.
Thanks for having me.
So the cause of death for this patient in California hasn't been determined, but of course a lot of people are concerned about it. They're pointing to the fact that he was vaccinated the day he died. He'd also recently tested positive for COVID. So what do you make of this, and why would someone get vaccinated so soon after they're infected with the virus?
You have to remember that people are going to die, people are going to get sick, certain conditions are going to be diagnosed after they've had the vaccine, but it doesn't mean that the vaccine had any role in that. There's just a certain number of things that are going to happen in everyday life that are often going to be blamed on the vaccine but have nothing to do with the vaccine. We usually tell people to wait 90 days since they've been infected to get the vaccine, and that's not because of a safety reason. It's so that other people who don't have any natural immunity can go ahead. So it's likely nothing to do with the fact that he was infected and then got vaccinated. This probably, once we look through the death certificate, once we look through the medical examiner's report, will probably be something that's unrelated to the vaccine, something that was a natural cause of death, and the vaccine just happened to be a coincidence. And that's usually what we see in these types of situations.
So what if a person has had the virus and it's now been 95 days or 100 days? Do you recommend that person gets the vaccine?
Yes, I do recommend people who've been infected with COVID get the vaccine, because that vaccine is going to boost your natural immunity, cause it to last longer, make it more robust. So I do think that this is something we want people to get, irrespective of whether or not they've had COVID. We tell them to wait only because we want other people to go ahead of them who don't have natural immunity.
So I've asked you this question before, but I want to emphasize it because it's a concern for a lot of our viewers. The vaccine was rolled out in record time, so you can understand why some people may have concerns about possible long-term effects that haven't yet been studied. One hospital in California, for example, fewer than half the eligible workers were willing to take the shot when it was first offered. So what do you have to say to people who are expressing reservations about getting the vaccine?
This is a very safe and effective vaccine, and we're in the midst of a pandemic that's killing 4,000 people a day. So when you look at the risk-benefit calculation that's needed to decide on the vaccine is highly favored in that risk-benefit calculation. And I was somebody who rushed to get the vaccine as soon as I was eligible for it and got my 2 doses because I wanted to be protected, and I know that this is a really good vaccine. It's important to remember, though, that anytime we have a vaccine, the long-term effects aren't usually necessarily known because we approve the vaccine and we study people for years afterwards. So this isn't anything different than we've seen with other vaccines. So, for example, with Gardasil, the HPV vaccine, we're still doing long-term studies on some of those individuals. There weren't any corners cut. The reason that this really was sped through development was because we've got new technologies that allowed them to enter clinical trials very quickly, this mRNA vaccine technology. So it's important to remember that though we have this vaccine a record-breaking time, it's something to celebrate. It's not something to worry about. And there wasn't any kind of safety that was kind of brushed aside in the studies or the FDA approval.
So we've been talking to you now, drawing on your expertise for months, and as more people are getting vaccinated, we learn more about these vaccines and the variants. Is there anything else you're learning about the variants and the vaccine that you think is important for the public to know?
What we're seeing is that our vaccines seem to be effective against the variants. It's important to test that with any new variant that takes hold. We want to make sure that the vaccine works, but you have to remember that a vaccine will provide not just one type of antibody, but a whole host of antibodies, as well as spark what's called T-cell immunity, a whole different arm of your immune system. So it's very hard to see a virus mutate to be able to completely evade a vaccine. And for what we're seeing right now, these variants aren't going to be much of a problem for the vaccine. Again, we have to continue to test this, and we continue to study it to know for sure, but I am pretty confident that the vaccine is going to work against these variants.
Well, that is good news. I know a lot of people are worried about that. Dr. Adalja, thank you so much for joining us tonight.
Thanks for having me.